Have you ever opened a hospital bill and felt a sinking feeling, wondering how you're going to pay it without spending all your savings? For millions of seniors across the country, this isn't just a worry, it's a harsh reality that weighs on their golden years. A single hospital stay can cost up to $15,000, and Medicare doesn't cover everything. But here's the game changer: 90% of seniors don't know that there are simple legal ways to cut their hospital bills and secure their financial future. At the end of the video, we'll give you the full Senior Health Tips ebook, including healthy vegetarian recipes for seniors' nutrition, handbook for seniors' emergency, first aid guide, herbal medicine handbook. Now let's dive into today's main content. End your hospital bill. Worry 5: Secrets to Saving Thousands of Dollars. Senior Health Tips. Today we're embarking on an emotional journey with two friends, Linda and Tom, who face skyrocketing healthcare costs, but discovered 5 how-to senior health tips to save thousands while staying healthy. This isn't a dry list, it's an inspiring story of resilience backed by practical strategies designed to empower seniors nationwide. Stick around until the end because the 5th tip helped Linda cut her dental bill by 70% and gave Tom peace of mind for his future care. Drop a comment now. What's your biggest worry about medical costs? Have you ever faced a bill that kept you up at night? We read and respond to every comment because your story fuels our mission. Let's start with Linda's struggle and the first how-to tip: negotiate your medical bills like a pro. A glimmer of hope in Linda's fight against bills. Linda, a 68-year-old retiree in Florida, was the heart of her neighborhood book club. With her radiant smile and warm voice, she always brought laughter and captivating stories to the group. But 2 years ago, her life turned upside down when a knee surgery left her with a $12,000 hospital bill, even with Medicare. "I felt like my world was crumbling," Linda shared, her voice cracking as she recalled those sleepless nights. "I was terrified I'd lose my savings, that my golden years would be nothing but a pile of bills." Linda isn't alone. Millions of seniors in America face staggering medical bills, from hospital stays and medications to services Medicare doesn't cover, like dental or vision care. According to the National Council on Aging, 28% of seniors rank medical costs as their top fear, outpacing concerns about health or loneliness. Linda felt trapped, unable to enjoy her book club gatherings or the short trips she once loved. One evening, while chatting with a close friend from the book club, Linda heard about a strategy she'd never considered: how to tip number 1, negotiate your medical bills like a pro. Her friend explained that hospitals often inflate charges to offset costs, and over 80% of medical bills contain errors, from duplicate charges to fees for services never provided. "I didn't believe I could do anything about a bill that big," Linda admitted, but she decided to try, refusing to let fear control her life any longer. Mustering her courage, Linda called the hospital's billing department and politely requested an itemized bill detailing every charge. When it arrived, she spent an evening with a cup of hot tea, carefully reviewing each line. She spotted duplicate charges for medical supplies and a fee for a service she never received. With the help of a patient advocate, a free service many hospitals offer, Linda negotiated with the hospital. She explained her situation, that she was a retiree living on a fixed income, and asked them to correct the errors and reduce the fees. The results were astonishing. A study from the Journal of Health Economics shows that 60% of negotiated medical bills are reduced by at least 20%. In Linda's case, the hospital agreed to remove the erroneous charges and offered a further discount, saving her $3,000. "When I got the new bill, I felt like I could breathe again," Linda said, her smile lighting up her face. "I realized I wasn't just a victim of numbers on a page, I could take action to change them." But Linda's journey didn't end there. She began digging deeper into ways to manage medical costs, and a new strategy emerged with how-to tip number 2: shop around for affordable care. Saving big with smart shopping. After her first victory with the surgery bill, Linda realized she needed to be proactive about healthcare costs. She started asking, why do the same services cost so much more at different places? How-to tip number 2: shop around for affordable care became her lifeline, helping her save hundreds of dollars without sacrificing quality care. Linda needed an MRI to follow up on her knee surgery, and the hospital quoted $200 for the scan. But instead of agreeing right away, she decided to do some research. A neighbor suggested she try Healthcare Blue Book, a free online tool that compares healthcare prices across local providers. Linda found a clinic just 15 minutes from her home that charged only $400 for the same MRI with state-of-the-art equipment and reputable doctors. A Consumer Reports health survey reveals that seniors can save 30 to 50% by comparing providers for non-emergency services like lab tests, imaging, or dental care. Linda saved $800 on her MRI and learned another trick, asking for cash discounts. Many clinics and doctors offer 10 to 20% off if patients pay up front, as it saves them administrative costs tied to insurance. Linda applied this strategy to other routine checkups, from blood tests to eye exams. She called 3 different clinics before deciding, comparing prices, and inquiring about senior discounts. "It felt like I was on a treasure hunt," Linda chuckled as she recounted her experience. "Every time I saved a few $100s, I gained more confidence to keep going." She even shared this tip with her book club friends, helping them save on services like dental cleanings or new glasses. But the story doesn't stop with Linda. Her close friend Tom was grappling with his own fears about medical costs. His journey began with how-to tip number 3: maximize Medicare and supplemental plans. Tom's victory over Medicare gaps. Tom, 73, a retired mechanic from Ohio, was a local legend for his passion for restoring classic cars. Weekends found him in his garage polishing every detail of his beloved 1965 Ford Mustang. But a year ago, a heart procedure left him with a $5,000 bill that Medicare didn't cover, threatening not only his hobby, but his financial peace of mind. "I thought Medicare had me covered." Tom shared, his voice heavy with disappointment. "I didn't want to dip into my savings or burden my kids." Tom felt betrayed by the system he'd trusted his whole life. He worried that more surprise bills would force him to give up his garage and become a financial weight on his family. But one afternoon, over coffee with Linda at a small-town diner, Tom heard about her success negotiating her bill. It sparked hope, and Linda introduced him to how-to tip number 3: maximize Medicare and supplemental plans. Tom dove into learning more about Medicare and discovered that Medicare Part B only covers 80% of outpatient costs, leaving gaps for services like dental vision or hearing aids. He attended a free workshop hosted by the local area agency on aging, where an expert explained Medicare Advantage plans, private insurance options that can replace traditional Medicare. Tom enrolled in an Advantage plan with a low monthly premium that included dental and vision coverage, something original Medicare lacked. A Kaiser Family Foundation report shows that 28% of seniors save thousands annually by choosing Medicare Advantage plans tailored to their needs. Tom's plan covered $2,000 of his dental work, including a bridge he needed, and provided free preventive screenings like blood pressure checks and diabetes tests. He also got a discount on new glasses, saving another $150. "I felt like a weight lifted off my shoulders," Tom said, grinning as he stood by his prized car. "I can keep restoring cars without worrying about surprise bills." But Tom didn't stop there. He wanted to ensure he'd never face financial uncertainty from medical costs again. This led him to how-to tip number 4: tap into community and government programs. Unlocking hidden resources with community programs. Inspired by his progress, Tom explored how-to tip number 4: tap into community and government programs. He learned that countless resources exist for seniors, but many go unused simply because people don't know about them. One morning, Tom visited his local community center and met a counselor from the area agency on aging who introduced him to programs like Medicaid, which supports long-term care for low-income individuals, and free services like health screenings and nutrition counseling. Tom discovered a county program that subsidized his prescription costs, saving him $300 a month on heart and blood pressure medications. He also signed up for a free medication delivery service, sparing him trips to the pharmacy in bad weather. The National Council on Aging estimates that 1 in 3 seniors qualify for benefits but don't apply, often unaware these programs exist. Linda, after hearing Tom's story, joined a free community wellness program. She got regular blood pressure checks, free flu shots, and even enrolled in a senior yoga class to improve her joint health. "These programs didn't just save me money, they gave me hope," Tom said, his eyes shining as he recalled picking up his first free prescription. "I realized I wasn't alone. There's a whole community ready to help." Linda felt empowered too. She started sharing information about these programs with her book club friends, helping them access services like free transportation to doctor visits or food assistance. But Linda's biggest breakthrough came when she uncovered a game-changing secret: how-to Tip number 5, use health-saving strategies for dental and vision care. Slashing dental and vision costs with smart strategies. Linda faced a daunting challenge, a $3,000 dental bill for crowns, a cost Medicare doesn't cover. She felt overwhelmed, worried she'd have to dip into her savings for a dream family vacation. "I thought I had no choice," Linda shared, her voice trembling. But then she read an article in an AARP magazine about how to tip number 5, use health saving strategies for dental and vision care, and it changed everything. Linda found a dental discount plan through AARP costing just $40 a year, but slashing her dental bill by 30%. She also contacted a local dental school where students provided supervised care at 50% less than private clinics. The American Dental Association notes that seniors can save up to 70% on dental care with discount plans or community clinics. Linda ended up paying only $900 for her crowns, a figure she never thought possible. She applied a similar strategy to vision care, finding an AARP discount plan that saved her $2 on new glasses. "I felt like I'd won the lottery." Linda laughed, tears of relief streaming down her face. She even used some of the savings to buy a small massage chair, helping her relax after long days. Tom, inspired by Linda, adopted this tip too. He needed hearing aids, which can cost up to $4,000. But through a Medicare Advantage discount and a community clinic, he paid just $1,500. "I don't just hear better, I feel more confident," Tom said, his eyes twinkling as he described hearing birds chirping in his garden for the first time in years. Linda and Tom's journey is about more than saving money. It's about reclaiming freedom, joy, and hope in their golden years. They learned to face their fear of medical costs, not by hiding, but by taking action with smart, practical strategies. Linda and Tom's story proves that skyrocketing medical bills don't have to take away your best years. These 5 healthcare tips for seniors negotiating medical bills, shopping for affordable care, maximizing Medicare and supplemental plans, tapping into community programs, and using health-saving strategies for dental and vision care can save you thousands of dollars, protect your finances, and help you live fully into your 60s. Take action today. Pick one tip to start, such as checking your next medical bill for errors or calling to compare prices for a service like an X-ray or dental exam. In just a few weeks, you could save hundreds, even thousands of dollars. Remember, every small step you take today is a big step towards securing your financial and health future. The Life After 60 would like to thank you for joining us, and as promised, we will send you the Senior Health Tips ebook. The ebook link we have pinned in the description. Please watch and give us your comments so we can create more useful videos for our seniors. Every view and comment inspires us to bring you more valuable content. Leave a comment so we can discuss which tip will you try first. Have you ever saved on medical costs with a smart strategy? Like, share this video with your family and friends to share these useful tips. Subscribe to the channel to follow more useful videos updated daily. And don't forget, Bon, our sincere companion who reminds us that health is the greatest gift of life. Together, let's make your 60s a vibrant and joyful journey. See you in the next video.